obesity medicine doctor and life coach here with another daily office hours question. Today's question is, I just went up to 5 milligrams of Zepbound. The nausea went away after 2 days, but the diarrhea was constant for a week. I went down to 2.5 because I couldn't deal with the diarrhea. But the problem with now the 2.5 is wearing off. Have you had patients experience this, but it went away eventually? Yes, I'm working with my doctor, but I just want other people's opinions and experiences as well. Okay, so the question is, this person went up from 2.5 to 5 of Zepbound, and they had a lot of bowel issues with that. And that is not uncommon. Usually, in my experience, it does tend to go away over time. And certainly if I have a patient that's really disruptive we'll use, Pepto-Bismol or Imodium or things like that to help get them through. But usually it is pretty short-lived. For some people, it's not, and you just won't know until you try. And a lot of times people are like, I don't want to try anymore, which is understandable. But for things like this, I think it is, if you have the bandwidth to do it, if I have patients like this, I will encourage them to persist and just see if it goes away, because many times it does, and that can make a real difference in terms of somebody actually staying on the medication or not. And sometimes these are just people who need to titrate a lot slower. But yes, in my experience, this is something that generally tends to get better with time and can also be slightly helped or greatly helped by some other medications as well to help with the symptoms. So definitely follow up with your physician, but it's worth seeing if these things help, because it could really make a difference between, for me, a patient staying on the medication, or we just don't use that medication at all, and we don't have that many options when it comes to GLP-1. So a patient can tolerate it eventually. That's always really, really good for me to know and for the patient to know. So thank you so much for that question, and please subscribe to my channel for more. It's the place for medically based answers to your weight questions.